prevalence of hearing loss in Kenya, disaggregated by age group and gender, and also the number of affected persons who are currently receiving hearing rehabilitation services in public health facilities across the country. This particular data is per county. And the other question is also regarding data. The CS will be required to provide comprehensive data on beneficiaries of government social protection programs. This is as disaggregated by program, category of vulnerability and county. So this is a sitting of the Senate that the senators will be engaging the cabinet secretaries. That is, if that quorum is attained. Remember, the provisions of the standing orders indicate that at least 15 senators, that is the Honorable Senator for Uasin Gishu County, Honorable Jackson Mandago, who is also making his way into the House. That quorum bell is particularly to alert the members of the Senate that there is a quorum hitch in the House, and that the presence is highly required. I can see the Senator for Embu, Honorable Mundigi, is trying to count the numbers of the members in the chamber just to find out on how many perhaps are remaining, or what the number in the House is, if they have quorated. On the question by nominated Senator Honorable Joyce Korir regarding the comprehensive data on beneficiaries of government social protection programs, the Senator would also want to understand, or want the Cabinet Secretary to provide the total funds disbursed under the various social protection programs in the last 3 years, and clarify whether there are any policy measures in place to review and enhance those allocations considering the rising cost of living. So these are 3 questions, but of course there will be follow-up questions, that is, if the House corrects and the business of the day or the sitting manages to kick off. But that is not the only business that the Senate has scheduled to transact this morning. Once the question time is over, and there is still more time for this particular morning sitting, or within this particular morning sitting, then there are other priority business that the Senate shall be picking up on or continuing on. Some of the priority business, or most of the priority businesses that have been lined up for consideration this morning are motions. There is a motion by the Honorable Senator for Busia County, Senator Andrew Omtata Okowit, and this motion regards the provision of IFMIS reports for county governments to the Senate. Reports that the senators will want to have an earlier interaction with before the Auditor General, or Office of the Auditor General of Controller of Budget provide these reports to the Senate to be able to consider them. This particular motion seeks to ensure that the Cabinet Secretary for Treasury provides these reports on a monthly basis to enable the senators have a timely tracking of the financial spending or usage of the funds to the Senate or to the county governments. The quorum, I believe, is about to be attained. Remember, the quorum at the commencement of the sitting of the Senate is 15. So we are still waiting for that quorum to be attained. But of course, once the quorum is raised, then the business that is scheduled for transaction this morning shall be able to take place, and the members of the Senate shall begin with interacting with the Cabinet Secretary for Labor and Social Protection, Dr. Alfred Mutua, being a Wednesday morning, where the question time has been allocated or slotted. The 10-minute quorum bell has also lapsed. We should be hearing from the Speaker on whether that quorum has been attained.
Take a seat, honorable senators. Clerk, you may proceed to call the first order.
Order number 1, administration of oath. Order number 2, communication from the chair. Order number 3, messages. Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion. Order number 7, questions and statements.
Honorable senators, we have 3 questions that are directed to the CS in charge of Labor and Social Protection. I'm informed that the Honorable CS is present. I'll therefore ask the clerk to usher in the Honorable CS. Honorable CS, welcome back to the Senate. You are here today to respond to 3 questions. One by the Senator from Makueni County, the Honorable Daniel Manzo. The second is by Senator Catherine Muma. And the third is by Senator Joyce Korir. We will start with question number 019 by the Senator from Makueni County. Honorable Manzo, you may proceed to ask your question.
Thank you, Mr. Speaker. Mr. Speaker, question number 019. Could the Cabinet Secretary confirm whether Mr. Sami Chengo, who was found dead at the Talanda Stadium construction site in Nairobi City, County, was formally registered as a worker under the contractor, and whether his terms of employment complied with existing labor laws? B, could the Cabinet Secretary provide information on whether any complaints or reports had been made regarding delayed or unpaid wages for the workers at the Talanta Stadium project and how such complaints were addressed by the ministry? C, what measures is the ministry implementing to ensure that all contractors and subcontractors involved in the major government projects adhere to the occupational health and safety standards to protect workers from avoidable risks? D, could the Cabinet Secretary outline the mechanisms available to provide compensation or other forms of support to the family of the deceased worker and any other person in similar cases? Thank you, Mr. Speaker.
Honorable CS, you may now respond.
Good morning, Mr. Speaker, sir, honorable members. Just as a matter of background, the Talanta Stadium project is a flagship national infrastructure initiative that commenced in 2024. It's being undertaken by a company called China Road and Bridge Corporation, which is an international engineering construction company with massive experience in many projects. At the time of the incident, Mr. Speaker, sir, the project had engaged a workforce of over 1,000 employees across various categories, including skilled, semi-skilled, and unskilled labor. To answer this very good question from Honorable Manzo, the ministry, through its field officers, who are mandated by Section 35 of the Labor Institutions Act to carry out workplace inspections, did inspect employment records pertaining to the said deceased worker. It was established that the late Mr. Sami Chengo was formally engaged by the contractor through an employment contract. As per the employment contract, therefore, the deceased worker was a valid employee of the contractor at the time of the unfortunate incident. Even though the employee had a valid employment contract, inspection revealed that certain terms of employment contained in the contract were not compliant with the provisions of the Employment Act Cap 226 and the regulation of wages, that is building and construction industry order. Specifically, the deficiencies noted relate to working wages and rest days. Mr. Speaker, on the 15th of December 2025, the contractor was issued with compliance directives to address all the deficiencies noted, including calculation and payment of all underpayment arrears due to the deceased and all the employees engaged by the contractor. This is in Appendix 1, and I refer members to look at Appendix 1. It is a letter from my office through the External Labour Commissioner requesting, informing this company of the breach. On January 15, 2016, the 2026 this year, the ministry noted that the contractor had not complied with the compliance directives issued, and therefore the contractor was issued with a notice of intended prosecution for failure to rectify the anomalies noted and refusal to pay the deceased worker and all other workers under payment arrears as directed by the County Labour Office. And this is also in a letter attached as Appendix 2, and members can go through it, also from my office. The ministry is currently preparing the case file for referral to the Office of the Director of Public Prosecutions to prosecute and enforce the law, including the recovery of arrears owed. And that we expect that file to be in the DPP's office latest Monday next week. Mr. Speaker, sir, with your permission, I'll move on to the second question about whether there have been any other complaints. The ministry has not received any complaints or reports regarding delayed or unpaid wages affecting workers engaged at the Talanta Stadium project. The ministry has mechanisms for receiving and addressing complaints or reports related to delayed or unpaid salaries, wages as guided by the Employment Act Cap 226 and the Labour Institutions Act 234 and also the Labour Relations Act Cap 233. The ministry has field officers in all 47 counties with the labour officers ready to receive and address such reports and complaints. And that's just to pause here, just to let Wananchi know that we don't practice slavery in this country. If you're employed, you should be paid. And if anybody is not paying you your wages, or the wages are delayed and they have not given you a schedule of how they are going to pay those wages in case of any financial difficulties, you have a right to report to any of the labor offices, and I've mandated my officers to take action immediately. We can't have people working and they're not being paid. We don't practice slave labor in this country. Specifically, given that Nairobi experiences a significantly high volume of economic and labor-related activities, the ministry has 2 field offices situated at Nyayo House and Safety House in industrial area within the county to enhance services delivery, strengthen oversight, and effectively manage workload. And if you are out there and you don't know where the labor office is, you just need to visit the office of the county commissioner or any of the national government offices, and you will be directed to that office. Mr. Speaker, just to explain how it works, upon receipt of the complaints or reports, the ministry properly addresses the concerns raised by. We always deploy labor officers to conduct workplace inspections and engage the employers mentioned. The inspection involves examination of employment records, including payrolls, contracts of service and statutory remittance records, and interviews with the workers to get their insights on the terms and conditions of employment and issuance of improvement notices to the employers. Institution of legal action in case of non-compliance in line with Section 87 of the Employment Act and in conjunction with the Office of the Director of Public Prosecution. C. Facilitation of conciliation meetings between workers and employers where necessary to amicably resolve disputes that arise. And C. Desensitilization of employers and employees on their rights and obligations to increase awareness and ensure compliance. The ministry remains committed to safeguarding workers' rights and encourages affected workers to report their grievances through the labor offices near them, etc. The last question, Mr. Speaker, sir, on what we are doing to ensure that subcontractors and subcontractors involved in major government projects adhere to occupational health and safety standards. The ministry has put in place measures to ensure that all contractors and subcontractors engaged in major government projects adhere strictly to occupational safety and health standards, therefore safeguarding workers from vulnerable risks. Let me pause here, Mr. Speaker, sir, with your permission to say that this is not only applicable to government projects. I have directed my Department of Occupation Safety and Health Act to inspect all projects in the country, whether private or government, to ensure that the minimum standards are put in place. I presented a cabinet brief and a cabinet memo that was approved by cabinet to strengthen and ensure there is compliance to occupation and health standards by government and the private sector. Mr. Speaker, sir, it should first be noted that enforcement is firmly grounded in the provisions of the Occupation Safety and Health Act 2007, Work Injury Benefit Act of the same year, laws which are enforced by the Directorate of Occupational Health and Safety Services within the ministry. These laws impose clear obligations on all employers, including contractors and subcontractors, to provide safe working environments. Secondly, Mr. Speaker, sir, the ministry through the Directorate of Occupational Safety and Health Services has established a dedicated construction safety division that focuses specifically on the construction sector. Officers from the division are employed to major projects to ensure continuous monitoring and compliance. DOSH also maintains a nationwide presence across all the 47 counties. Lastly, in addition, all construction sites are required to undergo mandatory registration before commencement of operations. This process ensures that contractors and subcontractors are formally brought within the regulatory framework and are fully aware of the statutory obligations on safety and health. And just to point out, Mr. Speaker, we've been shutting down and stopping construction activities that have not registered with us, that are just happening without our knowledge. D, Mr. Speaker, on the issue of mechanisms to provide compensation, the government has established clear mechanisms to provide compensation and support to workers who suffer injuries in the course of their employment and to their dependents, for workers who suffer fatal injuries in the course of employment. Under the Work Injuries Benefit Act 2007, employees or their dependents are entitled to compensation in cases of work-related injuries, occupational diseases, or death. Employers are required by law to report all workplace accidents, including fatalities, to the Directorate of Occupational Safety and Health Services. Upon this notification, the Directorate undertakes an assessment of the incident and determines the appropriate compensation payable. Therefore, the director issues a compensation award which is paid to the dependents of the deceased worker in accordance to the law. With respect to the specific case raised by Honorable Manzo concerning the Atalanta Stadium project, the employer duly reported the fatality on 13 September 2025 as per the legal requirement, and the compensation process for the dependents of the deceased worker will be processed subject to the conclusion of the police investigations into the cause of death. The ministry remains committed to strengthening enforcement, enhancing workplace safety, and ensuring that all workers are protected and that affected families receive the support due to them under the law. I submit, Mr. Speaker, honorable members.
Senator Manzo, do you have any supplementary question?
Yes,
You may
Mr.
proceed.
Speaker, owing to the case of Mr. Sami Chengo, Mr. Speaker, who comes from Makueni County, and also, Mr. Speaker, recently under the construction at Bomas of Kenya, a worker fell off, died, resulting to the workers closing the Langata Road across and causing a crisis. Because they said every time these injuries happen, Mr. Speaker, the government seems to be doing very little. In the case of Mr. Chengo, could the Cabinet Secretary then give us an update as to whether that process he has given under D has been compensated and how much money has been given to the family of Mr. Chengo? I thank you, Mr. Speaker.
Honorable Sears, you may respond.
Mr. Speaker, I did not get the first part of Honorable Chengo's, Honorable Manzo's question about the Bomas of Kenya. Somebody was crossing the road and there was a traffic incident.
No, Mr. Speaker, if I may clarify,
My
a worker, in that construction going on there recently, fell off from the construction site and died. Therefore, about 1,000 workers who are working there left the construction site because the complaint was every time there is an injury, very little is being done by the government, and they blocked the road almost the whole day, and a solution was later on reached in the evening. I've just indicated what is happening in the government construction sites and among other sites, but specifically in Mr. Chengo's case, now that under your D, you have said that you have a process which ensures that calculations are done. How much then has been paid or is due to be paid from your department or from the contractor under your supervision to Mr. Chengo's family? I thank you, Mr. Speaker.
Thank you for clarification, Mr. Speaker. With your permission, the incident of Bomas of Kenya was reported and it's under investigation. And if it pleases this House, I can bring a report about that incident also, because it's a different incident than this one. Unfortunate. On the issues of Bwana Chengo, I don't have the excuse me, I don't have the figures of how much we have put down for him to be compensated, but I can avail those to the honorable member in the House. But he has not yet been compensated because we are following up with the employer. As you can see, there's an attached letter, but I'm going to ensure that within a very short time, this is done, Mr. Speaker. I can issue a report back to this House within 1 month on the amounts and whether he's been paid or not, and the enforcement mechanism. Thank you, Mr. Speaker. Sir.
Senator Chute.
Thank you very much, Honorable Speaker. Honorable Speaker, I'm really shocked to looking at the response from the CS. It is his evidence that this contractor, which is China Roads and Bridge Corporation, was given a notice. And that notice is on the issue of deficiency noted on working hours, wages, and rest days. And 6 months later, he was given another letter to show cause. And on 15th January 2026, they had intent to prosecute that contractor. And we are in July. Now, what is the minister doing? Because it has taken over 2 years or 1.5 years and no action has been taken. And today, he is before this House telling us stories. And then on Monday, he's going to do the prosecutions or to recommend prosecutions. This is a joke. Please, Honorable Speaker, let him specify all those years, all those months, what was going on. I think this contractor he's doing most of the job now. He's doing Rironi Road, he's doing Bomas, he's the one doing Talanta Stadium, he's going to do even the airport. Kwani is he special? Why is he treating Kenyans like slaves?
What is your question?
The question is, why did it take this long to prosecute this person, this contractor? That's my question.
Senator Wambua.
Mr. Speaker, Senator Chure has taken words from my mouth, but I will just say this. Justice delayed is justice denied. 2 years down the line, this matter of the Chengo has not been addressed, and the ministry has identified a breach. They have even made an intention to pursue the matter in court, but that's where it ends. Mr. Speaker, the question that I have is, how much longer is the ministry going to take before they can take this matter to court and for justice to be served? I thank you.
Senator Mandago.
Thank you very much, Honorable Speaker. It's related to what my colleagues have asked, but I want to be very specific to the CS. You have been preparing this file to take to the Office of the Director of Prosecution. When exactly are you taking the file? And I think, Honorable Speaker, let me make a commitment and a date the file will be submitted to DPP.
Honorable CS, you may, just before you respond, Senator Wamatinga.
Thank you very much, Mr. Speaker, for giving me the opportunity to ask the CS a question. Mr. CS, we've had these incidences and accidents happening very often, especially in construction site. I was thinking that you would maybe take a minute to explain to the House the enforcement that you're putting in place, especially in the preventive measures, like wearing of the light clothing, and ensuring that the workers who go to site are equipped should an accident happen, that they will not suffer severe injuries. Thank you.
Senator Sigei.
Thank you, Mr. Speaker. I would like to get from the Honorable CS whether he's got statistics of such high-level construction sites on the incidences that have occurred. We have just been given by Senator Manzo only 2 incidences, noting that we have the same contractor with the number of projects across, whether he has the statistics of such incidences as a ministry for purposes of following through the recommendations that they would make with such contractors on how they treat their workers.
Honorable CS, you may now respond.
Thank you, Mr. Speaker. I want to thank the members for their very, very good questions. Just to point out that it's not been 2 years, just for clarity. The accident happened in December last year. It's been about 7 months. It's not 2 years since this accident happened, so we've been on top of things. The delay has been occasioned because whenever a death happens, it is not just a civil issue, it is a criminal issue. And so we've been working with the DCI to prepare a file so that this file can be used as part of the criminal part, because somebody died, so somebody was responsible for that death. That is why it has taken some time, but I have looked at the records, and as I said earlier on, Mr. Speaker, the file will be at DPP's office on Monday, and I'm going to push to ensure that the prosecution is done. So it's a very, very good question for the 2 honorable members. There's a very good question about enforcement being put into place to ensure that these things do not happen. As I pointed out just in cabinet, I present a cabinet paper to strengthen the work of the Occupational and Health Hazards Department. And I'm giving notice to construction companies all over this country that just like they do in other countries, you go to Europe, you go to Australia, you go to South America, North America, you find that it's very clear. Construction sites have toilets, they have rest areas, they have clinics, they have things that cover the occupational health of individuals. And I've commissioned my team, and I was talking to them just last week, to go around the country investigating and raiding construction sites and shutting them down. Just for information, we just stopped a government project that was going on somewhere in northern Kenya as a result of them not complying to these services. So we are going to improve these services. We have now just empowered the ministry to be able to carry this out. On the other issue about statistics, the good questions, I will be able to provide those statistics, Mr. Speaker, sir, with your indulgence. My team will prepare them this week, and I can provide them also next week around the same time. Thank you, Mr. Speaker, sir.
Now we'll move to question number 038 by Senator Catherine Muma.
Thank you, Honorable Speaker, for the opportunity to ask this question. Karibu sana. Welcome, Cabinet Secretary for Labor. My question is this. Could the Cabinet Secretary provide per county data on the prevalence of hearing loss in Kenya, disaggregated by age, group, and gender, and disclose the number of affected persons who are currently receiving hearing rehabilitation services in public health facilities across the country? B, could the Cabinet Secretary outline the long-term strategies in place to enhance affordable access to assistive devices, including hearing aids, to persons living with hearing loss?
Honorable CS, you may proceed to respond.
Thank you again, Mr. Speaker. Thank you, Senator Catherine Muma, for this very good question. According to the Kenya National Bureau of Statistics data from the 2019 census, we had 153,381 persons identified as deaf or having significant hearing difficulty in Kenya, that is from the age of 5 years and above. The 2019 census captured functional hearing difficulties, that is difficulty in performing tasks, rather than just clinical diagnosis. As a result, these numbers reflect self-reported challenges in hearing rather than clinical registry of hearing loss prevalence. Regarding the number of affected persons who are currently receiving hearing rehabilitation services in the public health facilities across the country, I would like to clarify that this information falls primarily under the mandate of the Ministry of Health. But as one government, we wrote to the Ministry of Health, and as you can imagine, there are so many health facilities, to the clinic, to the dispensary. So the data is being compiled. It will take some time for it to be compiled by the Ministry of Health. We are waiting to receive that data because people go and say they have a hearing problem, but that does not mean that they are deaf. They may have a hearing problem maybe because they have a flu or they caught an infection, which after it clears, the hearing problem ceases to be. So for them to really to be said to be deaf or hard of hearing, it has to undergo a full clinical process. I would like to clarify that this information, I've already said, as the lead agency for ear and hearing care, EHC in Kenya, the Ministry of Health maintains the clinical data, diagnostic registries and records of patients receiving rehabilitative treatment within public health facilities. So when we get that information from the ministry, we'll bring it here. If the ministry is not able to provide that answer, I would also request this House, with your powers, to also request the Ministry of Health to provide such data so that we can have that information clearly for the country as requested by Senator Catherine Muma. On the second question about long-term strategies, the Ministry through the National Council for Persons with Disabilities has developed a number of strategies to enhance affordable access to assistive devices and technologies as follows. We have created a partnership, and let me say, first of all, the ministry has been very heavily underfunded. I was with my PS here, Bwana Motari, very good Principal Secretary, and we've been talking about the things we'd like to do, especially for people who are disabled, but the cash is not there. The money is always underfunded. We have created partnerships with key stakeholders and SIG players in assistive technologies to provide assistive devices. These include APDK, Hope Mobility Kenya, and Bethany Kids, and at AT scale. We have developed a catalog of assistive devices to be tax exempt during importation, hence reducing their cost. And we are lobbying for the inclusion of more assistive devices and technologies in the list of items to be covered by the social health insurance. I submit, Mr. Speaker.
Senator Catherine Muma, do you have any supplementary question?
Yes, Your
You may
Honorable
proceed.
Speaker.
You may proceed.
Honorable Speaker and Senators, the response by the CS exposes clearly the fact that the government is not working as one. Honorable Speaker, I'm disappointed that the CS in charge of taking care of needs of persons with disability does not have data in respect of a category of persons with disability. In fact, he's throwing away and saying that the responsibility belongs to the Ministry of Health and telling us that he has asked the Ministry of Health to give him this data, and if the Ministry of Health does not give that data, that we as Senate should assist him to get that data. A very clear show that Article 10 in respect of including persons with hearing disabilities is not being implemented in this ministry. And that calls to question, what tools, CS, do you have to actually assist you to plan for categories of interest groups that you're in charge of? Clearly, from that answer, you don't seem to have any such tools. In the second one, the CS has given a vague answer about not having adequate budget and trying to partner with key players whom he does not mention. And again, showing clearly that the government of Kenya, as the primary duty bearer to these persons with a disability, is clearly not recognizing this role. So I would want to know, who is it, Honorable CS, do you hope will create a budget and where, in order for the needs of persons with hearing disabilities to be included as equal Kenyans, requiring to access services, whether of SHA or of these devices, as other Kenyans, as obligated under Article 10 of the Constitution of Kenya?
Senator Mbugua.
Thank you, Mr. Speaker. Mr. CS, according to the World Health Organization, 40% of hearing loss is preventable with early detection. What specific programs is the government implementing to help these people so that we can save the 40%? Thank you.
Senator Manzo.
Yes, Mr. Speaker, the hearings problem in Kenya is caused from work sites, either construction sites or construction of dams where they do blasting, like it happened in Twake Dam, or, Mr. Speaker, accidentally when a rocket ring fell in Makueni, Mboni constituency, and they caused a huge bang, Mr. Speaker, whereby out of that, which is also a part of the government to follow up, hearing problems ensued. So I want to ask specifically in relation to labor and construction sites, and also in the matatu sector, you know, those who work in loud places. What are they doing as a ministry under the labor sector to make sure that they have that data and they prevent these people from stopping, you know, from having permanent disability of hearing? Because I believe that should be his work and his ministry. I thank you, Mr. Speaker.
Senator Chuta.
Thank you, Honorable Speaker. I want to refer the CS. Yes, I agree with him. These issues are mainly on health issues. But then there is an answer he has given on question B of Senator Muma, Roman 2. The CS talked about lobbying or requesting for tax exemption during importation. And those are the things that are creating a lot of problems for people with disability. And I wanted to ask the CS if he has requested for it, if he has any evidence, whether in the written form or any correspondence, and then has the exemption been accepted? If he has communicated, if he has evidence, and if he has, through asking for exemption, if it has been accepted, and has been agreed by KRA. Thank you very much.
Senator Wambua.
Mr. Speaker, my question stems from the frustration expressed by Senator Muma on the manner in which this response has come to us. And mine will just be a very simple and direct question. Does the CS and officers in his ministry appreciate hearing challenges as an aspect of social protection that should deserve the attention of the ministry? Or is it their position that this is a matter that concerns the Ministry of Health, and then for us to ask them questions about hearing disability, we are kind of asking them things that they don't appreciate to be part of what they should be doing?
Senator Mandago.
Thank you very much. Yes. Whereas I agree that largely the matter of hearing impairment is an health issue, I would like to ask the CS, because we know deafness sometimes is as a result of excessive noise. And we've seen in construction sites, particularly those undertaken by large Chinese companies, that the Chinese workers have noise reduction devices in their ears, but the Kenyans who work for them are exposed to high noise pollution. What is the ministry doing to ensure that workers in a place with very high volume of noise have noise reduction equipment, and there is no discrimination in the provision of the devices, regardless of nationality, race, or color?
Senator Mariam.
Thank you, Mr. Speaker. My question is, according to the census 2019, there is 381 person on deaf. But my question is, does it mean 7 years later there is no other registration of the affected people? Thank you, Chair.
Honorable CS, you may now respond.
Thank you, Mr. Speaker, sir. I'd like to say that the government, yes, works as one, and we get data. It is very dangerous to provide data that is not verified. That is why I pointed out that we have written to the Ministry of Health to give us that information. It is also important to say that the census that was done then, to answer the last question, the first question, was captured by the National Bureau of Statistics. However, the Ministry of Health has kept the data of people who go to hospital. However, for you to be said to be deaf, you have to be clinically found to be deaf, and the numbers keep on changing every day because they report to us. We will go back to the ministry, it is verified coming to us, but I can also provide this Honorable House with the latest statistics once we get the information from the Ministry of Health, as I've said, by mid next week. In terms of the issue of the budget, and yes, we've been lobbying. My ministry is one of the most underfunded ministries, labor, social protection. And unfortunately, for example, this year we put in a line item, we put in some money for disability and others to do some of these works, and it was not included in the budget because, as you know, the basket is, the many needs in this country. So we are still lobbying, it's a lobbying issue, and we're able to get it. The good news is that any person who is disabled in this country, you get free treatment through SHA. All manner of, you can go to SHA, you can be hospitalized, it's 100% treatment through SHA. There is a question about, there was a very good question about children and early detection. And yes, when you get early detection, on early detection of these kids, it's done below the age of 5. As you know, treatment below the age of 5 is there. Once it is detected, you are put on a treatment module, and you're able to be guided. this government has enforced the CHVs, community health workers, and one of their mandates that we have given them as part of their routine as they go door to door is to report to us any forms of disability or illnesses that may progress with time, especially of small children. So we are able now to get that data and arrest that early enough. Mr. Speaker, sir, there was a question about heavy noise from construction sites, and quite interesting to see that a rocket fell in Makueni and had a big bang. And I'm not sure scientifically whether the falling of the rocket caused any hearing problems that were long-term. I think people got shocked and troubled. I have relatives down there. But the main issue, I think the honorable member is saying, is that it is important for us as a country to realize that noise, heavy noise, whether in matatus, whether in construction sites, whether in noises in churches, in bars, in discos, that noise has an effect on the lifestyle, and the long-term can have a long-term impact on the lives of people. So this is, I'm going to ensure that my occupational health standards, I'm going to publish a few guidelines very soon on what we expect in terms of decibels. You know, the county governments are mandated to ensure that noise protection and ANEMA and everything, but we're going to look at it from a medical and good working construction. There is a point that was brought about some of these contractors, I think it was Mheshimiwa Mandago, about them having hearing that some of the contractors have protective gear for their ears, but their workers do not. So that's something that I will investigate. I'll put it down as part of the checklist of my teams as they go round. There was a question about hearing aids, and I just want to say that we lobbied. Maybe my answer was not very clear. We were able to lobby, and as a result now, people who are bringing hearing aids, or you want to bring hearing aids, you write to my ministry and we give you a waiver, and so you don't pay any taxes. That lowers the price. So that's already in place. My principal secretary, I gave him permission to do that, and he's doing that every day. He's approving because we care. And just wanted to say that I think my answer is very clear, that we are going out of our way to ensure that we show that we care. I think we can do much more, and I'm going to streamline the system to ensure that we are doing much more, but I'm looking at coming back here. You can invite me anytime to provide the new data and some of the things that we are doing. So do not be challenged, do not be shocked if you see me walking around and shutting down some construction sites, or shutting down or stopping people who have excessive noise or behaving in a manner that is not properly, especially for our disabled. The law is very clear. We have passed a Disability Act. If you have a building, for example, that building needs to be compliant. You need to have ramps, you need to have lifts that once a blind person is able to touch the handles, the buttons, they can read, as they do in other countries, that is floor 1, floor 2, floor 3, floor 4. So, Mr. Speaker, sir, do not be surprised if some of the Senate buildings are shut down because they have not complied. So we are going to enforce this to ensure that all government agencies, whether national government, whether it's a judiciary, whether it's here, are complying with the law as an indicator that we are not taking this lying down, that this is very important for our people. Thank you, Mr. Speaker, sir.
Senator Sifuna. Senator Okech.
Mr. Speaker, this is just a quick follow-up, and thank you for this opportunity, Mr. Speaker. I just want to establish, Mr. Speaker, how true is it that the disabled are getting free treatment with the SHA? And Mr. Speaker, I think because this is a house of the people and a house of record, I would wish that perhaps the CS gets us this indication, maybe from the CEO of SHA, in writing, because the CS has just indicated here that all disabled people in the country, it doesn't matter which kind of disability you have, you actually get treatment for free through SHA. Mr. Speaker, I really want to be able to establish that fact, and if possible, indicated in writing, and if maybe we can get a further clarity from perhaps the CEO of SHA, because I know of a myriad of disabled people in Migori who cannot be able to get any medical treatment whatsoever if they don't contribute, or otherwise they just don't have money. So that fact must be established, Mr. Speaker. I thank you.
Senator Olekina.
Mr. Speaker, the question that I wanted to ask is the same question that has been asked by my colleague, but just for clarity purposes. Does disability in itself guarantee free SHA medical treatment, or is it a case of severe disability where some Kenyans might be able to get benefit with some programs with the county governments or national government? So it will be important for the Cabinet Secretary to distinguish that, because people who are disabled will now be flocking hospitals, and if they are sent away, they will actually start doubting the main purpose of this SHA. So, Mr. Speaker, if the Cabinet Secretary can clarify that, I'd appreciate it.
Senator Mudama.
Thank you, Mr. Speaker, for this opportunity. Mine is just a follow-up question to Mr. CS about the SHA also, but a bit different. I want to know what the CS is doing about the PWDs getting that special identification card that when they go, they just produce, especially those who cannot hear, cannot talk, because if they have that special card, identification card, they can then produce and they'll be served easily. And Mr. CS, maybe you can clarify about the SHA treatment, because there are so many of them in Machakos County who are being turned back from even government hospitals without paying SHA. And how do they get to enroll? How do the SHA people identify the PWDs so that they can be treated without paying? They have to have that special identity card. What are you doing about that to make sure that they all have it? Thank
Honorable
you.
CS, you may respond.
Thank you very much. I'll just combine the questions from the honorable members. I just like to clarify that last year, my ministry paid 4.4 billion shillings to SHA for severe disability, so that people who are severely disabled do not have to pay anything. There are other people who are disabled. For example, you may be recognized you are disabled because you lost one eye, or you hurt your knee, but you're still working. You're able to work, or you're able to serve. You're working now. Those ones are able to pay for themselves, because we can't just pay for everybody who is just clarified as disabled. But the ones who are really in need, you can tell this person is severely, they are children with autism, they are people who really need that help, are covered. And thank you, Senator Okech. I will find out. Mr. Okech, you talked about Migori. My PS is from Migori, and I've been telling him he thinks too much about Migori. He's made sure he's streamlined Migori very fast. And so we'll ensure that Migori is taken care of, and so is Machakos, where I served for 2 terms. Now, in terms of the PWDs and identity cards, a very good question. The National Council of Persons with Disability issues those cards. All a person needs to do is to go, there has to be a clinical from a hospital showing that they are actually disabled. And when that report comes and it is verified, then they're able to be given that card, which they're able to use. I've been pushing for us to be able to get to a place whereby I think Olekina will understand, because having lived in the US, whereby if you are disabled or you have that special card, you don't even have to pay for some government services, or you don't even have to pay for transport in government, run institutions. So that's where we are getting to. I submit, Mr. Speaker.
We will now move to question number 054. by Honorable Senator Joyce Korir. Honorable Senator, you may proceed to ask your question.
Thank you, Speaker. Honorable Speaker, my question is, could the Cabinet Secretary provide comprehensive data on beneficiaries of government social protection programs disaggregated by program, category, and vulnerability and county? B, when was the current social protection register updated? And what mechanisms are in place to ensure that the regular review, accuracy, and integrity? C, could the Cabinet Secretary indicate the total funds disbursed under the various social protection programs in the last 3 years and clarify whether there are policies, measures in place to review and enhance these allocations considering the rising cost of living? Thank you, Honorable Speaker.
Honorable CS, you may respond.
Thank you, Mr. Speaker. Sir, thank you, Madam Senator Joyce Korir, for this very, very good question. The government, through the State Department for Social Protection and Senior Citizen Affairs, is implementing various social protection programs for older persons and persons with disabilities. We have, number one, the Inua Jamii Persons Cash Transfer, which at the end of March 2026 had covered a total of 1,149,181 older persons cash transfer program beneficiaries and 63,958 persons with severe disability cash transfer programs. It's called PWSD CT beneficiaries, bringing the total payroll number to 1.2 million beneficiaries, upward of 1.2 million beneficiaries. And this may be of great interest to members of the Senate. If you look at the appendix at the back, it outlines what your county or each county, the members that are covered by this program from each county. 2 disability inclusion programs. We have the Economic Empowerment Program. The program includes initiatives designed to support entrepreneurship, employment, and access to financial resources to persons with disabilities, such as a startup capital and tools of trade program. This provides startup capital for small businesses, tools of trade aligned with beneficial skills, entrepreneurship, and financial literacy training. So far, we have 264 beneficiaries supported in the 2 financial year with a total investment of 12.28 million. The support is based on what we have on budget. We also support groups of persons with disabilities through grants to registered groups to establish income-generating projects in sectors such as agriculture, livestock production, small-scale trade, etc. A group of 88 groups were supported with upward of 7 million shillings in the last 2 financial year. We also do LPO financing program, which supports businesses owned by persons with disability through their access to government procurement opportunities, AGPO. It provides financing to enable business owned by persons with disabilities to fulfill government supply contracts. And out of this, a total of upward of 16 million was disbursed to businesses owned by persons with disabilities. We also provide assisted devices and services to promote mobility, independence, and participation of persons with disability in education, employment, and community life. This means that we've been able to provide wheelchairs, hearing aids, white cane, prosthetics, orthotic devices to close to 5,000 beneficiaries. We also do undertake training, mobility training and orientation training with acquired disabilities, provided training on mobility and independent living, and 87 beneficiaries supported in the last 20. For example, people get diabetes and become blind. And so we're able to assist them as they orient to their new way of living. We also have the Kenya Sign Language Training Program, which is implemented with the Kenya Institute of Special Education to sponsor public officers for training in Kenya Sign Language, and we took 375 public officers in 8 regional centers in the last financial years. As you know, these are critical for communication. We also have an education scholarship, which provides scholarship across different levels, and a total of over 3,000 learners were supported last year through this scholarship program. We have an autism program which supports people with autism and related development disabilities by delivering essential therapeutic interventions. In this financial year, 10,684 have received therapy services. This is in collaboration with the Nairobi County Health Facilities, KIC, and also with KEMSA. The Council is also providing medication to over 3,000 individuals, being provided medicines, and 1,182 individuals receiving other items of support, such as diapers. There was the other question of when was the current social protection register updated and the mechanism in place to ensure its regular review. The current social protection registry, the enhanced single registry, has 4.4 million households and over 16.6 million. The ESR was last fundamentally updated in 2024, but is continually updated to date on demand through on-demand update mechanisms. I'd like to point out that the President has given us a directive, and we are on the ground currently where we are undertaking a survey to be able to update this. Several institutional, technical, and operational mechanisms have been put in place to ensure ESR data remains reliable. We have designed it to collect, update, link, and ensure quality of data on vulnerable households. This is through periodic mass registration, census approach, and on-demand registration, where somebody can go and say we have a problem. I'd like to point out here, if there is somebody who is out there and is not receiving cash transfer, and they feel they are eligible to receive cash transfer, all they need to do is report to the nearest chief, and we get that information. So that's a mechanism we are using. We are able to control that data. And also to point out, Mr. Speaker, sir, that people who were working and are on pension are not seen to be vulnerable and so cannot be receiving the same amount of money. And there are some families, through our data, yes, wewe ni mzee, uko nyumbani, but you have a big farm that is giving you so many acres of maize, or you have children who are supporting you. You know, they even bought you a nice suit to go to church with. So we are looking at people really who are downtrodden with nothing. Hawana familia kuwasaidia, hata familia yake imefilisika, Mr. Speaker, sir, they have nobody and they are really poor. Those are the ones we are targeting, because the government does not have the resources to pay, because currently we are paying billions of shillings. We are transferring, this month alone we are transferring 2.7 billion shillings. 2.7 billion shillings. And if you do the math, it's a lot of money by the end of the year. We also have data that is collected through a standardized instrument, HTT, and it promotes consistency in data collection, comparability across counties, and objective poverty and vulnerability assessment. Data collections involve centralized verification in community structures, that is, enumerators at the household level, and local administrative structures, as I said, chiefs and county officers. And we use them to verify. You know, somebody says somebody disabled, so we use that government machinery to verify. And lastly, the ESR integrates data from multiple programs, cash transfers, partners, and allows two-way data exchange with other management information systems, such as the Hunger Safety Net, Management Information, Consolidated Cash Transfer Program, Community Development Management Information, Integrated Population Research System, which enables us to update beneficiary information continuously. And the other question was to indicate the total funds disbursed under the various social protection programs in the last 3 years and clarify their policy measures put in place to increase the allocation. My response is that the annual disbursements in direct cash transfers for the Inua Jamii cash transfer program for the last 3 years of 2022-2023 up to date is as follows. 1, older persons cash transfer program was 17.83 billion the first year, 18.69 billion the next year, and 26.39 billion the last financial year, respectively, bringing the total amount disbursed to 63.92 billion shillings for the last 3 years of this Kenya Kwanza William Ruto administration. It's good for you to note that the President gave a directive that money is transferred for Inua Jamii and the disabled before salaries of government workers in the executive are paid. So, and that is to date. The President is paid last in this country after all the other payments have been done. We have personal disability cash transfer programs was 908 million, 101.02 billion, and 1.36 billion respectively. The Social Protection Act 2025 provides legal authority for reviewing and adjusting benefits under two key provisions. One is a review on benefits, allowing the Social Protection Board to review the nature and extent of benefits where a beneficiary situation changes. This will be triggered where there is evidence of change in socioeconomic conditions, improvement, or even going down. And even in Section 939 on its indexation of benefits, provided the board may, in consulting the National Treasury, periodically review the social assistance benefits to accommodate changes in real value. For example, now we are giving, is it 2,000 per individual? We are waiting to look at the economic trend, the amount of money, to see whether that money can increase depending on inflation and what there is in the country. And finally, Mr. Speaker, the Social Protection Act leaves the determination of the specific transfer amount to the budgetary process, which have continued to prioritize horizontal expansion, increasing the number of beneficiaries, over vertical expansion, that is increasing the amount per beneficiary. I humbly submit, Mr. Speaker, sir.
Senator Joyce Correa, do you have any supplementary question?
Yeah, thank you very much, Honorable Speaker. I must thank the CS, but I would really want to know when is this increment going to be made, bearing in mind the cost of living is risen up. But finally, Honorable Speaker, allow me to ask the Honorable CS, could the Cabinet Secretary indicate whether there are long-term financing strategies to sustain and expand social protection program beyond annual budgetary allocations? I don't know if you will allow me to ask the last question or...
Yeah.
Yeah, and maybe the last question is, the Cabinet Secretary could also tell us whether the Ministry has conducted any evaluation to determine whether the programs have reduced the poverty and vulnerability in the country. Thank you.
Senator Modama.
Thank you, Mr. Speaker. My question to the CS is about the delays of the money that is given to the old, because most of them are really calling us and asking us what is happening with our money. Why can't you fight for us and, you know, we be paid? Like now they've not received their monies for some months now. Thank you, Mr. Speaker.
Senator Mariam.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the person with a severe disability. They need caretaker. Is the ministry paying the caregiver? If yes, if no, what is the way forward of the caregivers? Thank you.
Senator Manzo.
Yes, Mr. Speaker, I just want the CS to confirm what strategy they have or program to make sure that the monies which go to old people is on time and each one of them who is registered receives. Because a lot of time when it is sent, people have registered but they don't get this money at all. And the efforts to find a verification is difficult, and therefore they keep on coming back to elected leaders. I thank you, Mr. Speaker.
Senator Okenyuri.
Thank you. Thank you, Mr. Speaker. I would also wish to know from the Cabinet Secretary why the Inua Jamii cash transfer is stalling, especially notable in Kisii by yesterday. Most of the residents were not able to access the same, and this is arising from the technical hitches which we are experiencing from migration from the commercial banks to the mobile system. And attempts by residents to get to the local offices are unresponsive because those local offices lack the digital devices that they need to aid this. What is the ministry doing to address that so that we rescue most of our vulnerable groups from the distress they are undergoing at the moment? Thank you.
Senator Moruma.
Yeah, thank you, Honorable Speaker, for this opportunity to ask a supplementary question. My question would be, the frequency in which the beneficiaries of Inua Jamii are replaced. Because I know there are people who are beneficiaries and die, but I've never had people being replaced. And yet there are very many people who are supposed to really benefit. In my county, how many, for example, have been replaced in the last 1 year? Thank you, Honorable Speaker.
Senator Mandago.
Thank you, Honorable Speaker. Honorable Speaker, I'm looking at the data for beneficiary distribution per program per county. And I've noted that there are outlier counties like Kakamega with 54,000, Kiambu with 52,000, Kitui with 50,000, Machakos with 50,000, Meru with 50,000, Muranga with 63,000. Could the Cabinet Secretary explain, give details of why we have, for example, the highest numbers in Muranga, which ordinarily would want to believe in terms of economy and production, we will not be having as many vulnerable people as possible. While the average, looking at the list, is about 20,000 per county. Why these outlier figures?
Senator Majayo.
Asante Mtaiki Speaker. Mtaiki Speaker, nataka kumuuliza waziri wa wafanyikazi swala moja. La kwanza ni kwamba katika Kilifi County kuna sehemu fulani za towns ambazo zimetangazwa ama mijiji ambazo zimetangazwa kama municipalities, kama ni Mtwapa, Mariakani, Kaloleni. Sasa zimekuwa status yake ni ya municipality, na kufikia hapo kuna labor officers wako wanaofanya kazi katika wizara yako wanatakana kuzunguka na kujua kwamba sasa wafanyi kazi wanaofanya katika yale maeneo, hususan yale ambayo nimeyataja. Kuna makampuni mengi sana sasa ambayo yanaingia ndani ya Kilifi na kuanza biashara, lakini mishahara wanaolipa wafanyikazi bado ni ile iko chini zaidi. Hata wengine wana collaborate ama wanahusiana na makampuni yanahusiana na labor officers, wanafanya hali ya ufisadi ya kwamba hawakupatii ripoti wewe kama waziri wa wafanyikazi, kuona ya kwamba malipo ya zile kampuni ambazo zimeanza ile biashara ndani ya Kilifi County, hususan katika zile towns ambazo nimekuelezea ambazo zimewekwa kama municipality, wafanyikazi kufikia hivi sasa wanapata mishahara duni ambayo haiko sawa sawa na ile mishahara kama iliyoko Mombasa ama katika zile townships zingine ambazo zimetangazwa kama municipalities. Ni hatua gani wizara yako inafanya kuona ya kwamba wafanyikazi wale wanaofanya kazi ndani ya Kilifi County na hususan katika yale maeneo kama EPZ na zile kampuni zingine zozote ambazo ziko pale zinaweza kulipa wafanyikazi haki zao kulingana na sheria za zile mnaita minimum statutory government wages ambazo wewe ndio unaziangalia? Asante Bwana Speaker.
Senator Chute.
Nashukuru Mheshimiwa Speaker. Nilikuwa nafikiria Kiswahili nasema municipal sio municipality. Yo Mswahili sijui leo kidogo chelewa kidogo. Mheshimiwa Speaker, waziri iko siku nilisema dolari, nikaambiwa sio dolari. Kwa hivyo municipal ndio ile Kiswahili sahihi. Mheshimiwa Speaker, kwanza nataka kushukuru serikali yetu UDA. Ile pesa mahali kama Marsabit tunapata shida sana, hali ya umaskini iko juu sana. Na shukuru serikali ya UDA, ile nini nimevaa leo kuonyesha wale walivaa jana ile rangi yao, si mimi pia nimevaa rangi ya UDA. Na hiyo pesa vile inaenda Marsabit tutasaidia sana. Kwa nataka kuuliza waziri, hiyo pesa inachelewa inakaa mpaka miezi 6 bila kuingia. Ni kitu gani inachelewesha hiyo pesa? Na hiyo pesa vile inachelewa, utafanya nini kama waziri? Hiyo pesa kila mwezi ifikie watu wetu, ndio wapate rupurupu, ndio wasipate shida ya kuongoja hiyo pesa mpaka miezi 6. Shukran, Bwana Speaker.
Senator Mbugua.
Thank you, Honorable Speaker. Bwana CS, there has been allegations of this program having ghost beneficiaries. How serious is that problem, and what has your ministry done to mitigate against the same? Thank you.
Senator Sige.
Thank you, Mr. Speaker. My supplementary question to the CS is born from the beneficiary distribution per program per county schedule that is provided. Honorable CS, you have told the House that you have lately received directives from the President to re-register or continue registration and review of the beneficiary list. The information we are getting is that the system and criteria is a bit restrictive. I'm saying so, Mr. Speaker, because looking at Bomet County, which I represent, the number of persons with severe disabilities on statistics have got up to over 13,500 people. The beneficiaries thereof from the schedule, Honorable CS, is 1,177, meaning we have got people over 12,000 who still need this particular support. What measures have you put in place to either ensure that you have as many of those who are desirable of this support from the restrictive criteria that is used in incorporating them in the register of the beneficiaries? Thank you.
Senator Kathure.
Asante sana Bwana Spika. Swali langu kwa waziri ni ya kwamba kuna wazee wengi sana wamepitisha miaka 70. Kuna wengi walikuwa wanapokea zile hera, lakini siku hizi hawapati. Wametolewa kwa system na wajui vile watarudishwa. Wamejaribu katika sub county offices za social service, lakini wameshindwa. Kwa hivyo nauliza waziri, hao watarudi namna gani? Na wale wanafika umri wa miaka 70, mbona wasiwe moja kwa moja wanaingizwa kwa system? Sababu kuna wengi sana ambao wamepitisha hiyo miaka na bado hawapati, hawajasajiliwa kupata hiyo pesa. Naomba waziri, kama vile hii citizen inaweza kufanya kazi siku hizi, mbona asifanye automation ya kwamba mzee akifika miaka 70 vile chute, kama akifika miaka 70 anaingizwa moja kwa moja katika mfumo huo wa kupata hizo hera? Bwana Speaker, asante sana.
Senator Abbas.
Thank you, Honorable Speaker. Honorable Speaker, I want to ask the Waziri. Waziri, the statutory bodies like NSF, CBF and lab funds, they invest the pensioners' money to various projects. Like NSF is actually do a lot of investment. But, you know, whatever interest they get, whatever the business is made out of less, the only money that is made is not reflected back, or it's not back, contribute back to the pensioners. So what is actually, how much money does go to, after investment, how much money is back to the pensioners so that they can benefit? Most of the pensioners are suffering actually, and they're not paid anything, and their money is being used for investments. It is not actually paid back to them. So I don't know what is the Constitution saying, that pensioners must get their money after investment. At least they must get at least an additional fund. So instead of, you know, investing, people are building a lot of houses, they do a lot of investments. They even actually, like CBF now is actually contributing to roads, but the contributor is actually suffering. They don't even get their money. They get no benefit in that investment.
the breakdown as per the counties, so that at least we know which counties has benefited for this startup capital. Thank you.
Senator Chalagay.
Thank you, Mr. Speaker. My just follow-up question, and I want to thank Senator Chute for wearing yellow, which is UDA. And I think he's wearing a better quality, unlike yesterday, who wore butcher-like clothing. Mr. Speaker, my follow-up question is only one. One I wanted to know from the CS Labor, Governor Mutua, how long does it update the amount they give to the socially protected Kenya because of the high cost of living? And how regular does this ministry update on the list? Especially, Mr. Speaker, when you know, all of us, the Bible says we stay 70 to 80 years, but beyond that, you are called to the Mecca. So when that happens, how long does it take the ministry to update their lists and ensure that they capture the indigent or the adequate beneficiaries? And he should answer this question vis-a-vis, and I wish Waziri would be listening. Mr. Speaker, can you call the minister to order? He is consulting. Mr. Speaker, how long, I'm making a critical point, how can he distinguish Kenyans who earn pension vis-a-vis access to all the Kenyans who are indigent, and vis-a-vis Kenyans who are neither pensioners or indigent, so that they can access these socially protected funds through the ministry? I yield back the mic, Mr. Speaker, sir.
Okay, Honorable CS, you can proceed and answer, give responses to supplementary questions as we close this business this morning.
Thank you very much, Mr. Speaker, sir. Very, very good questions. There was the first question about long-term strategy to ensure that the government can actually afford this. And the good news that the law has been approved. Now we have an act, and we are setting up a board and a fund. So the fund will be able to have much more money than budget reallocation. So we will be able to cover more people. In terms of evaluation of the levels of poverty and everything, so the fund will be able to deal with those things. Let me talk about delays, because there's been allegations which are accurate of delays, but I want to tell this House that since I became the minister, I have ensured we don't have delays. For the last 1 year, people have been paid on time on the 5th, by the 5th day of every month. Last month, because of the budgetary cycle and the closure of books by Treasury, we were not able to pay for just last month. But we are consolidating last month, and this month are being paid together next week. By the 5th, they'll get double payment. So it had nothing to do with us. We were not able to be allocated that money to the central bank to be able to pay. But from that time, you'll all agree with me, we have made transformation. People used to queue. People used to take a boda matatu to go to their bank to get the money. We were able to transform the system, and I gave the word to, I was in Senate, I said we are making those changes. I made a policy change. Now people are paid directly to M-Pesa, Safaricom, money goes directly to them, and the pressure has come down. On the issue, and I'm consolidating the messages, if one of the issues that came up that has been brought twice was the issue of members of different places getting different money. You know, there was Mandago asked a question. There's a question asked by, I think, Bomet and others. And the question is, it's very clear. It is done based on population and also longevity. You find that Muranga, in our country, if you look at statistics, has one of the highest life expectancies. So we've got people who are poor, but somehow, maybe it's a water, maybe it's a idle, maybe it's whatever, they live longer than others. So you find there are more people who are alive, who are not kicked out of the system. There was a question, swali nzuri kuhusu limeulizwa na mheshimiwa kutoka Kilifi County kuhusu munisipaa na kazi ambayo ifanywa kuimarisha kwamba watu ambao wanafanya kazi wanalipwa mishahara inayofaa kulingana na munisipaa na kulingana na ile orodha ya ongezeko la mishahara ambao mimi niliweza kugazeti. Ni kumhakikishia kwamba nitauliza maafisa wangu wazunguke waangalie kuhakikisha kwamba watu wanalipwa mishahara kulingana na ile orodha ya minimum wage ambayo imepeanwa na serikali. Kwa hivyo na kuhakikishia kama mimi kama mkazi wa Kilifi pia nitahakikisha, lakini tukumbuke kwamba watu walipi mishahara kulingana pia na municipal peke yake, inalingana na ile orodha na sehemu zilipo kulingana na hali ya maisha ya eneo hilo, lakini nitahakikisha kwamba watu wamepata haki yao. Ningependa kuuliza waheshimiwa walio hapa kwamba muhakikishe kwamba mmepata ile gazette notice na mnalipa watu inavyofaa. Kwa mfano najua wengine wenyu mheshimiwa speaker pengine mko pia na house helps walio kwako nyumbani, naona mheshimiwa Charangai anapiga vizuri. Kwa hivyo tutaangalia kama ule mfanyikazi wa nyumbani wa house help amekanyagiwa chini na mheshimiwa Charangai alipo ile idadi inapaswa kulipa hapa Nairobi, basi tutamfuata tuhakikishe amemlipa, kwa sababu lazima tufuate ile sheria. Kwa hivyo munisipaa za Kilifi nitahakikisha kwamba watu wameweza kuzunguka kuhakikisha kwamba haki imeweza kupatikana ya kulingana na orodha ya the minimum wage ya kila mahali, sio Kilifi peke yake lakini katika nchi yetu yote ya Kenya. Ningependa kusema ya kwamba nimesema kwamba idadi ya miezi 6 haipo, ni miezi miwili tu, mwezi mmoja tu ndio watu hawajeza kulipwa. Kuhusu ghost workers, hilo ni jambo ambalo nilikuta wakati nilipoingia katika cheo hiki, nikatuma timu zangu chini na ndio tulisema tutumie ngao kuangalia kwamba na tukifanya verification tukampatia chief, sub chief, huyu mtu yupo hayupo, sababu tulikuta kwamba watu walikuwa wanafariki alafu wa familia yao inaendelea kupata hizo pesa. Kwa hivyo tukaangalia yupo ama yupo, huyu mtu kweli ni mgonjwa sio mgonjwa. Kwa hivyo it's an ongoing work ambayo basi tunaendeleza. In terms of I've answered the question about distribution and about wazee wengi ambao hawapati. I wish we had the enough budget to give everybody. Just because you hit 70 doesn't mean that you automatically qualify. You hit 70 and you're driving a Mercedes Benz doesn't mean that you qualify. You really have to be needy, and we have been a bit strict in terms of using a testing system to ensure that people qualify according to how much they need. The reality, Mr. Speaker, sir, and I think Mheshimiwa Chengai was not here when I was giving the earlier one also, it's very clear that we actually need 70 billion per year, minimum. But the budgetary allocation is 26 billion. We don't have 70 to 80 billion. That's what we really need to really cover the pocket. So this house can help us be able to mobilize more funds, but the fund that we are opening up with the board, the new board, will be able to help us get some of this money. In terms of the question about NSSF, very good question. It's a loaded question. I don't have the capacity right now to be able to answer that question. I need to get statistics, figures, and the work that we've been doing. So maybe you can ask that question as a substantive question. I'm ready to come here and give you a very strong and accurate answer. Mr. Speaker, there's the question about disability and income and the breakdown, and I will also be able to provide that to you on Monday. I'll provide this house with that information for the member to see the breakdown of the different. I didn't have the information with me today. I'll be able to provide that information so that you can see how they're going. Just to let this house know that this government is very clear. For example, the president has led with the Nyota initiative. And in that Nyota initiative, where we're giving startup capital, we are supporting young people of this country. We also have a component that's supporting people who are living with disability. And we're giving them money. And if you looked at the program as the Excellency President launched them, you see we are not leaving anyone behind. People living with disability are also covered in the Nyota program, in also other government programs, because this government really cares. And finally, the question about the update and the system that is used and everything, I want to humbly refer Mheshimiwa Chirangai, because he's a busy man. He came in just a bit late after I've already represented. If he can be able to look at the reply I gave in the response that is on page 1, 2, 3, 4, very well enumerated on that page 4. I don't want to have to read the whole system, the whole process again. I submit, Mr. Speaker, sir. Thank you.
Honorable Waziri, it's like Senator Mazayo has a clarification and Senator Okenyuri. And also I asked why some beneficiaries have been removed from the system and how they will be brought back because there is that challenge. And also how this, after you reach 70 and you qualify, because the government has all the data, why don't you just automate the system so that those beneficiaries get the support indirectly? Maybe with that, and Senator Mazayo.
Asante Mstahiki Spika. Mstahiki Spika, sehemu fulani ambayo waziri alikuwa hajaijibu ni ile ya kwamba ni lini atatangaza ama ataweka ile statutory notice ya kwamba kwa vile maeneo kama Mtwapa na maeneo mengine kama Mariakani yameshatangazwa kwamba hizo ni municipality, na sasa wale wafanyikazi wanaofanya kazi katika EPZ, wanaofanya katika zile kampuni ambazo ziko pale, ni lini ataweza kutangaza katika gazette notice waweze kuinuli ile mishahara kuweza kuongezwa, kuletwa status ya municipality, sio pale walipo hivi sasa wakiwa wananyanyaswa, wanafanya kazi na hawalipwi zile pesa kulinganishana na fidia za municipality. Asante bwana waziri.
Senator Ambo.
My matter is resolved. I'm okay.
Senator Kenyuri.
Thank you, Speaker. I wish to get clarity from the Cabinet Secretary because I reported a matter by yesterday in Kisii. Most of the residents who are receiving this, the transfer has stalled. And I needed a response on why, because I know, of course, we are transitioning from commercial banks to the mobile system. Attempts by the residents to contact the local offices in Kisii have failed because those local officials are not empowered with the digital equipment they need to assist these residents. What is the ministry doing to sort out that so that we get out the vulnerable groups from the distress they are currently experiencing? Thank you.
Senator Maria, you know I'm not opening for new supplementary questions. What is it?
Mr. Speaker, I'm not asking a new question, but my question has not been answered about the caregiver for disability, severe disability. They need assistance, and these guys are with them throughout. So is the ministry paying this caregiver? If no, why? Thank you.
Honorable CS.
Mr. Speaker, sir, I'd like to say that we have an automatic system that identifies those who get over 70. We are hooked up to the immigration and national registration of people. So we know when people get over 70. But just because you hit 70 doesn't mean that you qualify. You can hit 70 and you are a member of the Senate. So you don't really qualify to receive these monies. If we were decided to give monies to everybody who just hit 70 by virtue of just becoming older than 1 year older than 69 and beyond, the country would need maybe 300 to 400 billion a year to just give the money. So this money is meant as a social protection money for those ones who are really poor. If we were to cover those ones who hit 70, who need some bit of support, and we need about 70 to 80 billion shillings per year. So, but we don't have that amount of money. So we have to tighten the criteria to go to the really, really needy. That's why it's called social protection, to the ones who are falling through the cracks. So we hope as the economy grows and as we get the fund, we'll be able to cover more people. Kuhusu munispa, ningependa kumhakikishia mheshimiwa Kilifi ya kwamba tutatumia ile minimum wage gazette notice ambayo niliweza kupublish mwezi uliopita kuhakikisha ya kwamba watu wanalipa mshahara kulingana na ile minimum wage criteria ambayo nimeipeana. Kwa hivyo nakuahidi ya kwamba mimi hivi leo nikirudi kwa ofisi baada ya hapa, nitahakikisha maafisa wangu wa leba wametoka, wameanza kuchunguza kuhakikisha kwamba watu wamepata haki yao. As I said in the beginning, Kenya is not a country that practices slavery. People work, they need to be paid, and they need to be paid what they are owed, and they need to be paid what is right. So people for a long time are just making tons of money, thinking that you can get away with it. They need to know that this government will not allow that, that people need to get their rights, and that it doesn't matter what, if you're working, you need to be paid on time. If you're not being paid on time, there need to be a program of when you will be paid. Kuhusu the transfer from Kisii, I'd like to clarify that I am not aware of anything stalling. It has not come to my attention. All I know is that we have not paid. We have a deficit of only 3 weeks because the June's payment was not paid, but we are paying June and July together this month. So unajua people at times, wananchi can come to you panicking, and people complain. They don't get it for 1 week. You'd think they have not received for 1 year. So, and it's because it's a very, very important social protection. So my apologies, it was not paid because of the closure of the year. We didn't get the funds, but we have already prepared all the documents. My officers are here. We're just waiting for the money to come in this week. We're pushing the button. Next week, they'll get their double payments. And lastly, I totally agree. My apologies about not answering the question. The caregivers, yes, they are not covered. They are not paid anything because of the same problem of budgetary allocation. That would mean we'd be paying double and we'd have to reduce others. So we are looking at a system whereby we can be able to give them something. And so that's work in progress. I submit and thank you very much. I want to say, Mr. Speaker, if you allow me, that this has been a very enlightening moment, and it's very important, and I'm very happy the members of the Senate really care about what is happening to our people through the labor movement and also through our disability program. I appreciate, and I'm ready to come back anytime to be able to clarify on matters. Shukran.
Thank you, Honorable CS, for your time this morning to appear before the Senate. And thank you for the kind words that you have for the Senate of the Republic of Kenya. Actually, you can be able to see the difference between the two houses. Houses that means business and the other one, which, and the other house. Therefore, you know that crap is not about the goosey gentleman, but the remarks that I made to the Honorable CS. So you might be surprised why there is scrapping or food dumping. Okay, asante sana waziri kwa muda wako. Tumeshukuru sana, na tukipata nafasi nyingine tutakualika ndio tusaidie Wakenya pamoja. Before we get to the next business, honorable members, I want to make this communication that we have a delegation of teachers and students from Rokenya Academy School at the River Machakos County. Honorable Senators, I would like to acknowledge the presence of a visiting delegation of 5 teachers and 8 students from Rokenya Academy in the River Machakos County who are seated in the public gallery. The delegation is visiting the Senate for an academic exposition. On behalf of the Senate and on my own behalf, I extend a warm welcome to the delegation and wish them a fruitful visit. Thank you. Senator Kavindu Mudhama. Let's first welcome the visitors, and then you can ask later.
Thank you, Mr. Speaker, for giving me this opportunity to welcome the students from Athi River, Lukenya. Karibu sana, Senate. I hope you will learn something through our debates here, and you have a bright future. Just study hard. You can make it to any office in this country and even outside the country. Just be friendly to books and obey your teachers and parents. Thank you very much, and God bless you.
Very well. Yes, Senator Dr. Mboni Karwale.
Thank you, Mr. Speaker. Mr. Speaker, you noticed that after you called out the names of the school, all the children stood up, which is not the usual procedure in the House, but it is an acknowledgement of the high level of discipline in that school, Mr. Speaker. Mr. Speaker, I therefore request that you allow me to also join Senator Kavindu.
Please do continue.
Yes.
1 minute.
Yes, in 1 minute, I want to discharge what I've just received on the phone. I have received a congratulatory message from a leader from Machakos who asked me to convey. Former Senator of this House, Senator Johnson Nduya Mudama, has sent me a message asking me that I congratulate you for the high discipline in your school and the fact that he has had the pleasure of Senator Kavindu also receiving you. You know the history. Mr. Speaker, it would be nice for the children to know that in this very chamber, it is where their grandfather, Paul Ngei, would address the nation from this very chamber as minister and as MP from Kangundo. I thank you, Mr. Speaker.
Very well, thank you. Let's go to the next one.
Order number 8, motion, provision of IFMIS reports for county governments to the Senate. Resumption of debate, interrupted on Thursday, 16th July 2026. Question on amendment to be put.
Sorry?
Honorable Senators, I want to ascertain whether we have quorum to put a question on the amendment by Senator Wakububi on this motion. If we have the numbers to put the question. Clerk, do you have quorum? Then we defer the putting of the question on amendment and go to the next order.
Order number 9, motion, mainstreaming a framework for clean cooking in Kenya.
There being no other business. No, we are not able to put the question on the amendment. Kuna numbers.
So he was the owner of this. This is. And who is moving forward?
Senator Aminta Kibwana was to move this motion, but she is not around, so we defer under number 9. Next order.
Order number 10, motion, promotion of artificial intelligence, AI, and innovation policy in Kenya.
This motion was supposed to be moved by Senator Karungo Dhangwa. I can see she is not in the house, so we defer also this business. Next order.
Order number 11, motion, report of the liaison committee on the activities and operations of select committees during the third session 2024.
This order was to be moved by the chairperson liaison committee, the U.S. Trure, and I can see there is no member of the presidium to relieve me. Therefore, that order is defunct. Next order.
Order number 12, motion, report of the liaison committee on the activities and operations of select committees during the fourth session 2025.
That order is defunct again. Honorable Senators, that is the end of our business this morning. And there being no other business on the order paper, the Senate stands adjourned until later today, Wednesday, 22nd July 2026 at 2:30 p.m.